Thanks very much for joining us today, Professor PALOMBO. I wanted to ask you about some of the developments that you're looking forward to over the next 12 months for ESCVS. It's a great period of growth for the organisation. You've spoken to me about a few different aspects that you're looking to develop as we lead up to the Nice Congress next year.
Oh, I thank you for this opportunity you give me and you give to our society also. I think that the main developments of our society, as you know, our society is the oldest cardiovascular society in Europe. That means we have a long tradition, and what we call the fathers of this discipline of vascular and cardiovascular surgery the fathers were the founder of this society. So if we look forward, is because we have some predecessors who have built our discipline, and they were giants really. And we hope to go on, and we have to look also to the future, not only to the roots. And looking at the future, I think that we have two main streams to follow. The first stream is the education. It's very important. It's very important. We have a diminution of the vocations. I mean, less and less people want to become cardiovascular surgeon, for example, because it's very difficult and long period you need of studies, and you have to study all during your whole life. So we have to face the problem of education, and in this field the society is trying to give to the younger surgeons the opportunity, for example, during our meetings to present, to give a speech on their own research, on their own experience. That's very important for me, because in the great majority of meetings are only the leaders that are speaking and giving a speech, and we need to give some more space to the younger generation to present their experience. And this is what we are doing. Also, we have a prize for younger surgeons who give the best research paper in cardiovascular surgery, and every year is held this prize. And more than this, we started this year with a program of a winter and summer school that's dedicated to the young surgeons. The first edition was in Courmayeur in Italy, in the Alps, and the argument was how to prepare a scientific paper and how to give a speech during a congress. And we will have some more editions, of course. It becomes in some way regular, and we will have a summer edition in Izmir, and we have some more other initiatives. I can tell you there is a practical hands-on course on AAA treatment, endovascular and open, in Plzeň, in Czech Republic. We will have another initiatives of this kind in Zakopane, that's not so far from Krakow. It's a nice mountain place. So we try to involve more and more younger generation, and to have their support.
Okay.
Roots in the past, but looking at the future. Yes.
And then finally, for Nice in 2014, I know that there are some other new topics that you're exploring. You spoke a little earlier about bioethics. Can you tell me more about that aspect?
It's important, of course, in every profession, ethics, but it becomes crucial in our profession, because we are faced to a very important technological evolution of our profession that becomes more and more expensive. And you know that, especially in Europe, we are faced to an economical crisis. So it becomes every unit is budgeted and has to make some choices. With devices that cost more and more, you have to decide which is the patient you want to treat, and you have to face a dramatic problem. And I can assure to you that in the great majority of cases, universities do not give a specific education in this field. But this is one only of the aspects. Another very delicate aspect and crucial is the relationship with the companies, with industry. As I told you, the technological growth, impressive growth we have, and the growth of expenses, of course, makes the surgeon, makes difficult sometimes the relationship with the companies that are very important. I mean, they are a very important partner in our discipline and also in our education, I can say you. But we have to give some rules in this relationship. I think it's important. So, generally speaking, to be interested in ethical aspects of being a cardiovascular surgeon or cardiovascular specialist becomes more and more important. And we will try to organize some initiatives, maybe a specific session, with all the people who can be concerned all together to discuss friendly, if you want, on this subject that's very important for future generations of surgeons.
Great, thank you very much. We look forward to hearing more about these interesting developments in Nice in 2014. Thanks, Professor.